Hi, everybody. My name is Heather Augustyniak. I'm the lead survivorship nurse practitioner at Baptist MD Anderson Cancer Center in Jacksonville, Florida. I'm happy to bring to you our April Life After Cancer patient education series discussion with Dr. Blanche Williams. She's going to be speaking on coping with Scanxiety. So having anxiety with upcoming scans to assess for cancer recurrence. Dr. Williams is a clinical psychologist who specializes in the psychology of health and illness. She received her doctoral degree from Vanderbilt University and practiced in several states before coming to Jacksonville a little over 3.5 years ago. She joined Baptist MD Anderson Cancer Center at the time. She enjoys the sunshine and natural beauty of the Northeast Florida and what it has to offer, and is hoping that Jacksonville is the place where she settles down once and for all. As everyone knows, the pandemic has had its own sources of anxiety, and for her, coping with the pandemic, she's been reading, working in her yard, watching Netflix, listening to music, and enjoying spending time with her cats. Dr. Williams, thank you for coming and sharing your time and your knowledge with us today. I'm going to let you take over. But first, I would like to let all the participants know that they have the opportunity to ask questions of Dr. Williams through the chat session on this webinar. And at the end, I will moderate those questions directly to Dr. Williams. Thank you, Dr. Williams.
Thank you, Heather. So bringing my slides up. Takes a moment. Here we go. Well, so I'm really happy to be here and to talk with you about what has come to be known as Scanxiety. And the question, first of all, is what is Scanxiety? It's a term that was coined in the last few years. And of course, it's not really a dictionary word, but it's a word that has a lot of meaning to people who have been dealing with cancer. Scanxiety is said to mean the apprehension you feel as you await an imaging test, a scan. But I like to broaden it because we know that it also includes waiting for the results of the test. So there's the time leading up to the scan when people tend to feel anxiety. And then there's the time of waiting for results when that anxiety continues. So that's what we mean by Scanxiety. And to psychologists, Scanxiety is a type of what we call anticipatory anxiety. So anticipatory anxiety is anxiety that develops as we are anticipating some event. And that can be any kind of event, whether it's one considered a positive event or one considered to be a negative event. It's something coming up in the future that we begin to feel anxiety about. So could be, I know I'm going to do a talk today and I feel some anxiety about that before the talk starts. Could be that you're going on a road trip and you feel some anxiety about the preparation and actually being on the road. Or it could be anxiety about a medical test or something like that. So anticipatory anxiety happens when you know that something lies ahead and it's going to require something of you. And ordinarily, just in the regular chain of events in life, when we know that something lies ahead, this information is processed first by the thinking part of the brain, which is right in the front. It's called the prefrontal cortex. And this part of the brain is the part that just helps us think through things, helps us analyze, helps us make judgments and make decisions. That's what the prefrontal cortex is for. It's our thinking brain. And once the information is processed here in the front, then it gets sent along with the rational analysis that prefrontal cortex has done, it goes to the emotional part of the brain, which is buried deep inside toward the back. And this is called the amygdala. And so that part becomes engaged. So then you get emotion to go along with the rational thinking that has already happened. Now, of course, that process is very, very quick, but that's the way it would ordinarily happen. When the anticipated situation seems like a threat, however, something different happens. The amygdala, that emotional part buried in the deep part of the brain, is activated really at the same time that the prefrontal cortex is activated. And so it doesn't get the rational thinking coming to it at the same time that it's getting the information about a threat ahead. So therefore, it just acts on emotion. It senses danger, and so it makes a survival response. The amygdala is responsible for helping us survive in a literal sense, but it also will do it in an emotional sense. The survival response is a split-second reaction that's meant to protect you. So the survival response is what we know as the fight or flight response. And actually, what the survival response does, what the amygdala is trying to do, is to get you ready to confront whatever is out there in the world that may eat you up like a saber-toothed tiger. This is a process that developed in animals and then in people through evolution, and it's just wired into us that when we feel threatened, we will have this survival response coming from the amygdala, and it causes us to be ready to fight, to flee, or to freeze. And this happens because the amygdala causes different parts of your body to do different things, one of which, the most important of which in our case here, is that it causes the organs to release adrenaline and cortisol. And adrenaline, you're probably familiar with, it hypes you up. Cortisol is very similar, hypes you up. And it makes other changes in the body as well. So with these changes, including that adrenaline and cortisol pumping through your bloodstream at this point, your body is now ready to confront an attack by a saber-toothed tiger. So it's like this emotional part of the brain is operating as it did in cave people, who always had to be ready to confront a tiger or an alligator or whatever was out there to eat them up. Our amygdala operates in the same way. We, however, have that prefrontal cortex that's much better developed than they had. And this is something that animals don't have. So what I'm describing is a hardwired process that occurs in the body. And many people will say, if it's hardwired, then there's nothing I can do about it. Well, what I want to talk to you about today is the fact that, yes, there is something you can do about it. The amygdala has done its thing, has put you into the mode of a survival response when you are looking ahead at getting a scan and waiting for results of the scan, because it recognizes that this seems like a threat. But you don't have to be ruled by your amygdala. You can bring the prefrontal cortex into play so that it can de-escalate the emotions that have been brought up. And the emotions we're talking about really, it's one emotion, and that is anxiety, or a similar emotion, fear. So we can learn to de-escalate these emotions by becoming engaged in other things, and by, again, engaging that prefrontal cortex by focusing on different things, and by being attentive to what goes on within ourselves. So now I want to talk about how we do that. So I'll just go over the basics here, and then we'll get into how you go about dealing with these different parts of the process. So basically, it's important to acknowledge the emotions that you have. So the emotion that is probably at the top of the list is anxiety, as you are facing a scan and facing getting results. But you can narrow that down, and there are different types of anxiety. It could be a sense of apprehension. It could be concern, which would be the least difficult to deal with. It could be, however, fear. Could be worry, which again is just a different type of anxiety. It could be a sense of feeling alone or lonely with what's going on. Could be a sense of feeling overwhelmed, or some people would just say stressed. There could be other emotions. It's good to acknowledge what those emotions are, and in a minute we'll get to why that's important. It's good to acknowledge the physical sensations. When we talk about anxiety, there are going to be physical sensations. Sometimes they are very, very obvious. Other times you may not realize they're there until you think about it and try to identify them. So here's a list of examples, and there are many more that we could list. Your skin might tingle, your heart might be racing, you might feel restless, physically restless. Muscle tension is one that occurs quite frequently. Nausea, jitteriness, your hunger might be off, where you either don't feel hungry at all or feel like eating more. There could be a knot in your stomach, a lump in your throat, and on and on. But these are all physical sensations that you can identify. You wouldn't have all of these probably, but it's good to identify which ones you do have. And then along with emotions and sensations, it's good to acknowledge what thoughts, what specific thoughts you have about the upcoming scan and about those emotions and sensations that are going on. And we'll talk about those in a minute too. It's very interesting to look into what kinds of thoughts or beliefs are actually going on in your mind as you're dealing with anxiety, and then whether or not those thoughts or beliefs are rational. After examining those three areas, then essentially you're going to be looking to engage in calming activities and in distracting or refocusing activities. So let's get into a little bit more about how to do these things. So first, acknowledging your emotions. It's good to put your acknowledgement into actual words. Put it into a sentence that says what you're feeling emotionally and why. So here are some examples. I'm getting ready to have a scan, and I realize that I feel nervous because the scan might reveal bad news. Now, maybe that sounds like an obvious sort of statement to you, but the point is that I'm actually putting it into words. It may be obvious, but I'm putting it into words. I'm nervous, and here's why I'm nervous. I might feel scared about the possibility of recurrence, or scared of the possibility of having to do chemo again, or scared because of something else. So again, putting it into words. I might feel, just as another example, lonely because no one's around to go through this with me, or maybe I feel lonely because the people around me can't identify. They don't know what it's like inside my skin. There could be many other kinds of feelings that you could identify. You actually use the word and then say why you feel that way, what it is that causes you to feel that way. Now, why is it important to put it into words? Feelings like anxiety are very amorphous and uncontrollable. This amorphous feeling that just goes in all kinds of directions is very hard to put your hands on, very hard to grasp in any way so that you can try to do something about it. And when you put words on the feelings, you turn them into something more concrete, that your prefrontal cortex, this part of the brain that's going to help us with the analysis and the judgment, can do something with. So yes, as we have at the bottom of the screen there, the concrete thoughts allow the prefrontal cortex to come into play, and we want it to be involved when there's something like anxiety to deal with. So we do a similar thing in acknowledging our physical sensations. Identify the sensations within the body. So there was a list of possible sensations a couple of slides back. So I may say, this scan is coming up and I notice that there's a lump in my throat. Again, the word that I use to describe the sensation helps to categorize it, to make it more concrete for me. I may say, first of all, I'm feeling funny in my chest, and then maybe I spend a little more time kind of focusing on that and say, oh, what it is that I'm feeling my heart racing, or I'm feeling muscle tension in my chest, or I'm feeling heat in my chest. So identifying what the sensation is makes it more concrete. Again, by doing this, you're involving that prefrontal cortex into the experience. And the prefrontal cortex is going to help you then be able to bring some rational analysis into the situation. And you can remind yourself that human bodies evolved to respond to frightening situations so that people could be ready to protect themselves. And when you are feeling these sensations in your body, that's exactly what's happening. Your body has been prepared to help you do what you need to do in the face of a saber-toothed tiger. And at that point, you can also tell yourself, because how we speak to ourselves makes a great difference. You can tell yourself, you know, I do have something coming up that is scary, makes me nervous, makes me feel sick or tingly or tight, but it's not a saber-toothed tiger. It's not some animal standing right around the corner that's going to eat me up in just a minute. So then acknowledging what thoughts you have. Now this becomes really kind of interesting. The prefrontal cortex can help you break down what thoughts you're having. What you may be experiencing most intensely is the feeling. And and possibly also the sensations, just anxiety, nervousness, fear, heart racing, dry mouth. That may be what you notice first. But by bringing the prefrontal cortex into the situation, you can start to figure out what kinds of thoughts you're having that go along with those emotions and sensations. One sort of thought that is very, very common in this kind of situation is, this is awful. This waiting is awful. This fluttering that I feel inside is terrible. I can't stand it. Another kind of thought that is typical is something like, I know I'm going to get bad news. I know it's going to show this. I know I'm going to have to do chemo. And on and on. So here you have begun to break down your actual thoughts. And knowledge is power. That's true in most cases, and it's certainly true here. So you've identified the specific thoughts that you're having, or at least some of them. And at this point, you can determine, are these thoughts helpful or not? Well, in the case of those that I just named, this is so terrible, this is so awful, I can't stand it, I know it's going to be bad news. Those thoughts are not helpful. They're not rational. And when we recognize that some or all of our thoughts about a situation are not helpful, then we have the chance to change the thoughts that we focus on. Now, this is not to say that this is easy to do. Don't mistake me. I'm not saying this is an easy process, but I'm walking you through something that can be a process for you to help you as you are anticipating a scan or results. So you can determine what thoughts you would prefer to focus on. And as long as those thoughts that you prefer to focus on are rational, then they can be useful to you. Now, some people might say, well, the thought that I prefer to have is the scan's going to be negative, I'm going to get great news. Well, that's positive and it might be preferable, but is it rational? No, I don't know that I'm going to get great news any more than I know that I'm going to get bad news. So that's not a rational thought that would be good for me to focus on. Instead, what about thoughts like these? Now, these particular ones may not suit you, but these are just examples. So what about, I will be okay? Now, that's not saying what my results will be. That's not saying what I'm going to hear when I meet with my oncologist. That's not saying what the experience of going through a scan is like. What it does say is that whatever the situation is, however it unfolds over time, I, as a person, will be okay. I may not like it, but I will be okay. Another thought that is preferable and rational, if this is true for you, is something like, I trust my oncologist, I trust my treatment team, I trust those who are going to give me the scan. If it's true, that can be a preferable thought to focus on. Another similar one would be, my doctor has always given me, has always delivered news in a way that I can understand, or delivered news in a way that I could swallow and be able to ask questions about. What I'm saying is it's just a statement about what you do know. And these kinds of statements are much calmer statements than those like, this is awful, or I know I'm going to get bad news, or even I know I'm going to get good news. Because that second one about getting good news stirs up adrenaline of a different type when you're expecting something very good. Another positive rational thought that you might focus on would be, well, it's good that my case is being followed closely. It's good to have scans every 6 months or whatever your schedule is. So these are thoughts that you can use to replace the ones that are not being helpful to you. So what I recommend is that when you develop some thoughts like this that are rational, that you write them down, and then you can be reminded of them at any time. Put them on your phone. Perhaps bring it with you when you come for the scan or for your appointment, and focus on thoughts like these. Now, I mentioned using both calming activities and refocusing activities. There's not a clear distinction between the two lists, but some things fit more into the calming category and some more into the refocusing category. Calming activities are those that are meant to calm your heightened emotions and your bodily sensations. So repeating that list of preferred realistic thoughts is a calming activity. And again, when I say calming, I don't mean that it would have an instantaneous dramatic effect. No, I just mean that it provides a calming influence to you and your mind and your whole system. You can, as another example, focus on those emotions and sensations you've identified and remind yourself that it's okay to experience them. This is a calming activity that's quite rational to do, because often what we're telling ourselves about our emotions and sensations is that we shouldn't be experiencing them. You know, we will try to say to ourselves something like, I shouldn't be anxious because I know it'll be okay. Well, that's not true. Anxiety's built into being human. Or I shouldn't, my muscles shouldn't be tense because it's just a scan. Well, that's not true. Your muscles are tense. So it's not helpful to say they shouldn't be. So remind yourself that it's okay to experience these emotions and feelings. And in telling yourself it's okay, you are actually creating a bit of calm and peace for your system. You can do things like meditation. If that's something that you know how to do, you can certainly download apps that will take you through a very brief and simple meditation, and that is highly recommended. Listen to music, take a walk, stretch, go to the beach, pet an animal, care for an animal, very calming. You may remember reading probably a couple of decades ago that it was discovered that petting a dog lowered blood pressure. And we know much more about that now. It does all kinds of nice things for us. It is very calming to pet an animal, assuming you like animals. Eat a comfort food, but I say that with a little caution. Make sure that you're doing that healthfully. So maybe one donut is okay, but 3 donuts are not okay. Put on comfortable clothing, snuggle in a soft blanket, do an arts and crafts project, do a relaxation exercise, and I'm going to show you a couple of those in a few minutes. These are examples of calming activities. You can add to that list yourself. but these are ones that are very common for people to use. Now, what about refocusing activities? Some people call it distraction, and that's what it is. It's distracting you from the thoughts, feelings, and sensations that have really taken over your brain. But another word for it, which may communicate a little bit more, is refocusing. So the reason that refocusing or distraction is important is that anxiety itself is unfocused energy. It's energy that just goes in all kinds of directions. And at the same time, when we are in that survival mode that the amygdala causes, our focus does narrow to the thing that we believe is a threat. So we notice much less of what's on the periphery of the threat. And our mind focuses too much on something like a scan. So anxiety steals our attention. So it's important to identify activities that will refocus your energy and attention. And how do you do this? Think about what you like to do. Think about what you might need to do. Think about what you might want to try that you've never done before. These activities, and I'll give you some great examples in a moment, but these activities could be small acts. They could be more major. They could be fun things, serious things. They could be active. They could be something you do sitting in your chair. They could be alone or with others. It's just that they are things that take your attention, activities that take some attention and that you can get engaged in because there's some enjoyment or you see some need to get involved. And what's an example of something you might need to do? Well, here it is, almost April 15th, or this year it's going to be May 19th, I guess, when taxes are due. Maybe your taxes aren't done. It's something you need to do. So that can certainly refocus your attention. And finally, as we're thinking about what can refocus our attention, make sure to incorporate laughter. When you are looking for things that will refocus your attention, look for something that will make you laugh. Laughter, physical laughter, laughing out loud, is so good for us in so many ways. And if you don't incorporate that, you're really missing something that can be so helpful. So let's talk about planning for Scanxiety. Now, you might say, I don't even want to think about my next scan because it's going to be a while. But I would say you don't have to think about the scan, but let's think about planning for handling a period of time when you're feeling anxious. And the way to do that, as far as I'm concerned, is to keep a running list of possible activities that could help you. And I recommend this to people all the time. And in a moment, I'm going to show you a list of activities that have come from people I've worked with. This list would include both calming activities and more active ones that are refocusing you or distracting you. It's something that you can work on over time. If you sit down to make a list right now, you may come up with 3 or 4 or 5 activities or 10. And maybe tomorrow you think of another one, and next week you think of a couple more. Keep adding them to this list. No idea is wrong or shouldn't be included on the list. as long as the activities you put there are not ones that could lead to excess or danger. And what I mean by that is, you know, someone might say, well, to calm myself, I'm going to put drink some wine or beer on my list. Well, it may not be the best idea if there's the least possibility that one could lead to more than one. So if something excessive could come about, this could go with gambling activities or anything you get involved in that that actually brings some damage to your life through the amount of time or the amount of energy that you put into it, would not be something to place on the list. And then by calling this a list, I certainly don't mean a to-do list. If you think of it as a to-do list, you're probably just adding to your stress. This is a list of options. So let me show you an example that, again, is taken from other people's lists. So one person might say that an option for me is to write in my journal, and I also like playing with my dog. Those are good things to do when I'm feeling anxious. Another person may have said, you know, there's a certain person that I don't call enough, and it's always great when I call and talk to that person, like my niece. What about washing my car or taking my car for a car wash? Some people love a bubble bath or taking a shower, making a new recipe. And if you have certain ones that you've been thinking about, you might list them there. Reading a book, doing stretching exercises, listening to relaxing music. Now here's a different one. Spend some time looking for new artists on Spotify. So this is an activity that is all about looking for things, because the person who came up with this was interested in doing this. Take a walk, go to the Arboretum or to some other location that you like or that you have been wanting to visit. You can have things on the list like vacuum the house, dust the blinds. What about this one? Do a random act of kindness. That's a great one to put on your list. You know, doing something kind for someone else actually brings about a certain reaction within your brain and body that changes the hormonal mix in a good way. It brings down the cortisol, which I mentioned earlier, and adds some goodies as well. Some people like to smell a scented candle. Actually several people will talk about spending time learning a new skill, and sometimes they will list the kinds of things they might want to look up on YouTube. So one person said, oh, I love to go on there and learn new makeup techniques. Another says, you know, I want to learn to do some more things around my house for maintenance, like fixing a toilet or making pizza dough or some other kind of recipe. Watching a funny movie or show. So there's bringing in the laughter, listening to show tunes or whatever you happen to like, reading a short meditation, naming things I'm grateful for. This can be very helpful. And I'm going to add a caveat here. When you think about things you're grateful for, it's not, what's good about it is not that you're trying to replace whatever bad feelings you have with grateful feelings. It's that you're expanding your view. So it's possible to say, I'm nervous, I'm scared, and I'm grateful for the sunny day, and I'm grateful for the family member or friend giving me a call this morning. Could be something else around the house, breathing exercises or sensation exercises. So those are some some examples, and you see there's a blank for number 26, which means if this is my list, I'm leaving the option to add to the list as I think of more things that might be helpful to me. So I want to leave you with two different relaxation exercises that can be very, very effective. And you may be familiar with either or both of these. If so, you may have learned them in slightly different ways, which is fine. But I'm just going to show you the way that I tend to do them. And you can certainly modify them as needed. So the first one is calming yourself with breathing. And we know that taking in oxygen is something that is good for every single part of our bodies. Of course, we have to do that to live. Taking in extra oxygen is especially good for every part of our bodies. And that includes the brain and the mind. The breath can help to control some of those bodily sensations when we control the breath, and we have the opportunity to do that. So if possible, sit or stand straight and tall. Now, if you're in a recliner or bed, that's fine. You don't have to sit or stand. But if you're sitting or standing, make your spine straight if you can, and drop your shoulders. You know, when we are nervous, we tend to do this. If you can see in me in the picture, we tend to do this with our shoulders. Drop your shoulders, feel your arms hanging, and as you count to 7, take in a slow, deep breath, like, and then hold it for 7, and then let it out on the count of 7. And then breathe normally. Now, these numbers, the 7s, are not important. 7 is what happens to work for me. Some people would say I can't make it to 7. Some people would say inhaling to 7 and exhaling to 7 is fine, but I can't do a pause that long. That's fine. Use the numbers that work for you. If 6 and 4 and 6 work best for you, do it that way. After you take a few normal breaths, you can repeat this again. And it does bring the oxygen into your body and controls your breath in such a way that other parts of your body are going to start coming under your control as well, really under the control of the breath as well. So that is the breathing exercise that I recommend. There are variations and they're all fine. They all do the same thing. So I really recommend that you put on your list the breathing exercise. And quickly, let's go to the final one I want to show you, and that's the sensation exercise. So remember from school, there are 5 senses. And what we're going to do in this exercise is to engage all of the senses one by one. And that's going to help to distract you from the sensations that are going on in your body that seem out of control. So here's what you do. It's a 5, 4, 3, 2, 1 exercise. Name 5 things you see right now. So if I'm doing this exercise, I'm going to say, I see a window to my left. I see a door with a pewter colored door handle. I see a brown Kleenex box with white tissue coming out. I see a white digital clock, and I see a picture in a pewter frame. Name 4 things around you as you touch them. So I can touch the pad of paper beside me. I feel the sensation of my sweater on my arm, just below my elbow. I can touch this laptop and feel that part of it's a little bit warm because of what's running inside. And I can touch the desk, which has a very smooth wood surface. Three things you hear. I hear this laptop fan running. I hear traffic outside my window. And for this, I might have to really focus in because I'm not sure I hear a third thing just automatically. But as I focus in, I'm going to find a third thing that I can hear. And actually, I do hear the beat of something. It's probably someone outside with some music going. I hear like a bass beat going on. So I had to get really still to do that. And that is an important feature of this exercise. Name two things you can smell. That can be kind of hard too. You really have to focus in. So just with me, what I'm smelling right now is a little bit of a scent from popcorn that was popped earlier, wafting down the hallway. And I might have to get more creative to get a second scent. So I might, in order to do this, I might pick up this bottle of lotion and open it and sniff it, and I can smell the lotion. And then finally, name one thing you can taste. You know, even when you're not eating, there is taste there. So I can explore what the taste is in my mouth and describe it or give it some name. So there you go. We've gone very quickly through these exercises and through my recommendations to you. It's been a pleasure to talk with you, and I look forward to answering any questions you may have.
Thank you, Dr. Williams. One of the questions that one of our viewers brought to our attention was, what about those patients that actually don't require scans for their cancer and that provoking anxiety?
Oh, that's interesting too. Yes. Well, you know, we're really looking at the same kind of situation where you're anticipating something. You're anticipating the possibility that you're going to that there's going to be some clue that something is wrong, whether that comes from your doctor's exam or from your own exam, or just some feeling you have in your body. So you can use the same kinds of principles. You recognize that you're feeling this anticipation and that it's a fearful anticipation. Tell yourself, I'm feeling scared because I think something could happen that's wrong, and I don't want that to happen. I go through the same kinds of things, and you can use those same techniques, the breathing techniques, the sensory techniques, the list of activities to do to calm yourself.
And the final question is, if they feel as if they need additional support, is their oncologist able to connect them with you and your colleagues?
Definitely. The psychology service is part of Baptist MD Anderson Cancer Center. And you can access us in one of two ways. You can have your oncologist or your anyone on the medical team to make a referral to us and let us know that you need an appointment with us. And by the way, we do appointments at the moment virtually over Zoom. Or you can call the Baptist Behavioral Health phone number, which I'll give you in just a second, and let them know that you are an MD Anderson patient who would like to get an appointment with one of the MD Anderson psychologists. And that way they would refer you over to our office. The number that I want to give you is for behavioral health in general. So you do have to let them know you're interested in the cancer program. That number is 904 638 3800. I'm going to check to make sure I said that correctly. No, I didn't. I didn't say it correctly. Sorry about that. Let me start over. The number is 904 376 3800. 376 3800.
Well, thank you, Dr. Williams, for this excellent presentation. For all those that are on the line, thank you for your questions and and Dr. Williams for answering them. Next month, we have Dr. Todd Robinson. He's with the Natural Medicine Advisor Wellness Working Group. He's an integrative oncologist. It should be an interesting topic. His presentation will be Tuesday, May 11th at noon. And for those that are interested in our Life After Cancer support group for maybe talking about issues that were presented today with Dr. Williams, or other issues that are expressed in that support group are learning to live with the uncertainty after a cancer diagnosis, or issues with survivor's guilt, or coping with a new normal, or staying motivated with incorporating the lifestyle changes that are needed to reduce your risk of recurrence. All those are covered with our social work Sherry Dowd. And the next support group is Tuesday, April 27th at noon. Again, my name is Heather Augustyniak. I'm a lead survivorship nurse practitioner here at Baptist MD Anderson Cancer Center, and I would like to leave today's meeting with Dr. Williams' office number should you feel the need to make an appointment with her or one of her colleagues. That number again is 904-376-3800. Thank you, Dr. Williams. I hope you have a blessed day.
Thank you.